So you have general microneedling, right? The SkinPen microneedling. And that is taking a bunch of tiny little cluster of needles to very, very rapidly puncture the skin in and out. It's kind of using a motor to vibrate the needles against the skin. So it's causing little micro injuries in the tissue to essentially trigger our own healing response to replenish that damaged tissue with healthier collagen and elastin. So it's really great for retexturizing the skin, minimizing pore size, fine lines, wrinkles, even scarring as well. It wouldn't be my first choice for reducing pigment, but there is a little bit of a benefit to kind of reduce hyperpigmentation or discoloration to the skin. And it's a great way to kind of build collagen around that under eye to kind of make it a little bit thicker rather than that thinner skin. So can reduce dark circles around the eyes. Yes. General microneedling, because it is using that rapid skin pen to penetrate the skin, does get a little bit more pinpoint bleeding to happen. It used to be called the vampire facial because you do get a lot of nice bleeding to happen. And then a step up from that general microneedling would be RF microneedling. So our Silpherm is a device that we have at MD Beauty Lab. And it's absolutely amazing for still that benefit of retexturizing the skin because it does have that little cluster of needles, but it's a different mechanism. So the needles are going very cleanly in and out of the skin before it's being moved to another area. And then when the needles go into the skin, a burst of radiofrequency wavelengths are heating up the tissue to around 42 degrees Celsius. So it's really warm. It is energy, but it presents as heat. When the needles go into the tissue and heat up the skin to around 42 degrees Celsius, it triggers a metabolic reaction to cause more of a tightening and lifting to happen. So we're getting that retexturizing, minimizing pore size and fine lines, as well as a dramatic lift and tightening to happen. Really great for that lower face and that kind of jowls and elasticity that we're seeing there. One thing that's great about our Silpherm that I absolutely love, that I haven't really seen in other RF devices, is we can actually go super, super shallow within our needle depth. The most shallow that I've really seen, around 0.3 millimeters. So it's really great for kind of getting that under eye and like upper lid. So we can safely treat that lid to kind of give it a really nice tighten lift to your brow. It ranges from 0.3 millimeters to 3 millimeters. So if you ever wanted to treat body, which I've done before, like cellulite or laxicity above the knees, it's really great for as well. We can go a little bit deeper for those more thicker areas. Really great for reducing stretch marks as well to like the abdomen. I've even done breast stretch marks as well. We want to make sure we're safely treating that area, of course, but kind of helps, again, just soften up that texture to the mark. It's amazing for scars, especially post-procedure scars, like your tummy tucks or breast lifts or anything like that. It is really great to treat your scars as they're healing to kind of promote even better healing and to break up that scar tissue that's forming. But of course, we'd always want to advise your doctor to make sure it's safe to treat. A series of 3 is like a great way to start with your microneedling. I always say we're working against age, environment, genetics even, and we're working on a cellular level. We're kicking in that healing response. So it does take, multiple sessions to see your optimal results because we are slightly changing the structure of the tissue with every treatment. After your treatment, you'll have like a little bit of downtime of some slight redness, a little sunburny feeling where that inflammation's built, that acute inflammation's built. And so you'll feel tight, a little warm, very red. But once that's through, you can notice like a little bit of dryness happening, right? Some little flakies to the skin, and that's your cell turnover rate regenerating. Then once that's done, you get this beautiful instant glow to your tissue. Everything looks so much healthier, and then you fall in love with it, and then you come back for your next one. Around 4 to 6 weeks is my favorite timeline before treating again. I always say you can never overdose on collagen, and we're just going to keep building collagen. So if you love microneedling, it's safe enough to do monthly. but it depends on your budget and your timeline and what you have time for. Here at MD Beauty Lab, we charge around $450 for our SkinPen general microneedling. We price it like that because we always do full face and neck within our treatment, so we don't separate the two. Everything you do to the face, you want to do to the neck, or else you'll regret it. After microneedling, I say kind of treat your skin like an open wound because we do have those little microchannels from the needles. So keep it nice and clean, free from bacteria to make sure we're not risking any infection to the skin. You do want to stay away from bringing any bacteria to the tissue. So no exercise, no soaking in a hot tub, no saunas. That could possibly make you sweat, of course. And then there's this infamous story that I learned in school of someone went and got microneedling and maybe didn't hear or didn't listen about the no bacteria on the skin. And she went home and started blowing dirt to her yard, like putting on fresh dirt, and got this insane infection because there were just dust and dirt particles in her skin. And it was this huge thing. So no yard work, no gardening, and no sun exposure. It does depend on your skin type. So people that are maybe a little bit more pale and kind of hold their redness a little bit longer than others, it can last up to 48 hours, but typically it's around 24. I don't think microneedling hurts at all. I think it's uncomfortable, but it's quick. And of course, we always topically numb, so that does kind of help mute some of the discomfort, but mostly you're going to feel like the tickles of the vibration from the general microneedling pen, but it should never hurt. When we're using a topical numbing, it takes around like 10-15 minutes for it to start kicking in. You can maybe notice like a little bit of a purging effect after your microneedling. Nothing to be alarmed of. If it's like a breakout here and there, that's truly just a purge from your skin because we're bringing up that impurity to the surface of the skin so that it gets out. For microneedling, I always typically recommend keeping it nice and clean. It's the best thing for the first day. And then my absolute favorite post-care is to use Skin Medica's TNS. TNS is a growth factor serum, and so it's going to help promote healing within the tissue. I always say it cuts your downtime in half, speeds it up a little bit more. And who doesn't love growth factors? Growth factors are essentially stem cells, right? And so they kind of go into the skin and then transform into whatever the tissue is missing. So it's going to promote healing and reduce inflammation in the tissue so that you have a little bit of a thicker barrier. We just want the little microchannels after microneedling to close up, which takes around 4 hours for them to close up. But I always say just try and keep it nice and clean and clear of anything else for at least 24 hours. But after that, you're safe enough to put on your makeup or preferably that tinted SPF to cover up some of the redness and possible like petechiae that you have afterwards.